Hola amigos, feliz viernes. Hoy es viernes, yo soy Rory y estoy contento de estar aquí contigo. Hoy nuestro tema es conversaciones sobre la contracepción, es decir, métodos anticonceptivos o planificación familiar. Son palabras normales para hablar de la contracepción. Entonces, contracepción, anticonceptivos, métodos anticonceptivos, like birth control methods, planificación familiar, family planning. Ok, empezamos con un poquito de vocabulario. Primero, el método más efectivo, más eficaz, la abstinencia. El anillo vaginal, vaginal ring. El condón, condón interno, like a female or feminine condom. Capuchón cervical, like a cervical cap. Dispositivo or DIU. This was a IUD. Diafragma, diaphragm. Espermicida, spermicide. La esponja, sponge. El implante, implant. La inyección, injection. La ligadura de trompas, this is a surgery now, tying the tubes. El método del ritmo, so rhythm method. El parche, a patch. La píldora o la pastilla, the pill. Y la vasectomía, vasectomy. ¿Ok? Muy bien. All right. Continuamos con algunos efectos secundarios posibles. So, tenemos algunos métodos o maneras de tener planificación familiar y ahora hablamos de algunos efectos secundarios posibles o comunes. El cambio de hormonas a veces resulta en efectos secundarios. So changes in hormones sometimes result in side effects. Algunos son deseables, some are desirable, como periodos más ligeros, like lighter periods, y periodos más regulares, and more regular periods. Pero hay otros también, otros efectos secundarios, but there's others also. Acné, aumento de peso, weight gain, cambios de estado de ánimo, so changes in mood or mood swings, coágulos de sangre, blood clots, dolores de cabeza, headaches, mareos, náuseas, so dizziness, nausea, pechos adoloridos, sore breasts. Pechos is a common word for breasts. You could also use senos or mamas. Periodos irregulares, irregular periods. Periodos más abundantes, so heavier periods. No sé, tal vez con el té de cobre, like the copper IUD, right? Sangrado o manchas entre periodos, so bleeding or spotting between periods. Manchas is a good word for spotting, okay? Spots. Sentirse hinchada, feeling bloated or bloating, okay? Hey, are you learning something new right now? If you are, first of all, I hope you are, but if you are, make sure you like, subscribe, follow our channels, and because that's how we're able to continue doing this and sharing this information with other healthcare folks just like you working on their medical Spanish. Okay, verbos de contracepción. When you're talking about these contraception methods, often you have to use some verbs that maybe you didn't pick up in your high school Spanish class. Entonces, cambiar is to change or exchange. Por ejemplo, cambiar, si usas el parche, necesita cambiar el parche cada semana. You got to change the patch or exchange. Colocar. Colocar is like poner, but it's got this idea, this subtle idea that it's a very specific and intentional placement. So, colocar. So, el profesional tiene que colocar el DIU, el dispositivo, right? La enfermera de práctica avanzada, la enfermera, la médica, la partera, etc. Coloca el dispositivo. Contagiarse una infección, essentially to get an infection, so in the STI conversation. Contagiarse una infección. Costar, cost. Durar, to last, so durar cierto tiempo, ¿verdad? El parche, remember we cambiar el parche, solamente dura una semana, tiene que cambiarla cada semana. I don't know if that's true, but because you be the expert on the actual medicine. Evitar, avoid. Insertar, insert. Liberar hormonas. Liberar hormonas, maybe we're talking about an implant or talking about un dispositivo and libera hormonas is like it releases hormones, okay? Poner, to put or place. Prevenir, to prevent. Protegerle contra, so two common verbs that you might employ as you're talking about STIs, STDs, that kind of thing. Prevenir, prevent. Protegerle contra, protect you against. Recordar, remember. Requerir una cita. Requiere una cita requires an appointment. Retirar o quitar, to remove or to take out. Tomar la píldora, so just take the pill. Usar por tiempo, usar por ejemplo un mes o 2 meses o 5 años, etc. So using something for a certain amount of time. Usar a certain number of times. Now, okay, so the difference here is usar por tiempo. Now we're talking months, weeks, years, whatever. Usar número de veces, think condoms. Usar una vez, and so vez is the way you say time in Spanish for occurrences, not for a length of time, but for instances or occurrences. Okay, so usar una vez el condón. All right, cuando estamos dando educación, there might be a handful of topics or temas que puedes incluir o quieres incluir en tus conversaciones con tus pacientes. Entonces, algunos temas importantes de contracepción pueden ser la eficacia de prevención del embarazo, so how efficacious something is or effective something is to prevent pregnancies. Tiempo de duración o uso, so the length of duration or use. Si ayuda a los periodos, if it helps women with their menstruation. Si ayuda a prevenir las ETS or ITS, so if it helps prevent STDs, STIs. Si requiere una receta médica, if it requires a prescription. Si requiere un proveedor para obtener o colocar, so if it requires a provider to get this thing or to place it. Si incluye hormonas, if it includes hormones. Los efectos secundarios, the side effects. Y el costo, yeah, and the cost. Okay, let's look at un ejemplo de educación, los condones, por ejemplo. Usar condones ayuda a prevenir los embarazos y las enfermedades o infecciones de transmisión sexual. So using condoms helps prevent pregnancies and STDs, STIs. Debe usar condones, you should use condoms, cada vez que tienes sexo vaginal, every time, each time that you have vaginal sex, anal, anal, u oral, para protegerse contra la ETS, to protect yourself against las enfermedades de transmisión sexual. También los condones son eficaces en prevenir el embarazo. So also condoms are effective in preventing pregnancy. Son entre 85 y 98% efectivos. So they're between 85 and 98% effective, dependiendo del uso correcto, depending on correct use, en evitar embarazos, in avoiding pregnancies. Los condones son económicos, they're economical, y los puede comprar sin restricción ninguna, and you can buy them without any restrictions, okay? Hey, Mastering Medical Spanish, if you've never heard of it, is our flagship course. It's 3 different levels, beginning, intermediate, and advanced. We offer it twice a year, and this is your best way to learn medical Spanish online. It's a combo of online lessons that you work through on your own and live classes scheduled every week. It lasts 10 weeks, this course does. We offer it twice a year, fall and spring, and so whenever you're seeing this video, there is a time coming up when we will begin our next session of Mastering Medical Spanish. If that sounds interesting to you, if you need to earn some CME credits and you want to do it learning medical Spanish with Common Ground International, check out this QR code here and you can enroll today in the next session of Mastering Medical Spanish. Okay, let's move on to otro ejemplo de contracepción, el implante anticonceptivo. Let's talk about the implant for a minute. And again, there may be information, more information you would include, less information, but use this as an example for talking through some birth control methods. Entonces, el implante anticonceptivo es una pequeña varilla, it's a little bar, que un médico o una enfermera necesita poner en el brazo, that a doctor or nurse needs to put in your arm. Libera hormonas, it releases hormones en el cuerpo que previenen el embarazo por hasta 5 años, that prevent pregnancy for up to 5 years. El costo del implante varía, so the cost varies dependiendo de su seguro, depending on your insurance. Puede costar, it can cost, hasta $1,300 y requiere una cita en su centro de salud. And it requires an appointment in your health center. So it can cost up to $1,300 and requires an appointment. El implante es muy eficaz. It's very efficacious en prevenir el embarazo, in preventing pregnancies. Es el 99% efectivo en prevenir embarazos. It's 99% effective in preventing pregnancy. Y también ayuda a tener periodos menstruales más ligeros. There's a small error in here. Should be ayuda a tener periodos más ligeros. Okay, so it helps you have lighter periods. Algunos efectos secundarios comunes del implante son, some side effects that may be common of the implant son manchas entre periodos, so spotting in between periods. Dolores de cabeza, headaches, dolores de pecho, dolor de pechos, so breast pain y náuseas al principio, and nausea at the beginning. Es importante recordar que el implante no protege contra las ETS. It's important to remember that the implant doesn't protect against STIs, STDs. Necesita usar condones para protegerse contra las ETS o ITS. Ok. Ese es un ejemplo un poco más completo que el ejemplo de condones. This one's a little more complete than the condom example. Pero tú necesitas practicar. There are lots of verbs and vocabulary and things that we've been using in these examples. Pero para conversar con tu compañero, selecciona un método anticonceptivo abajo y descríbelo siguiendo el modelo de los ejemplos. So select a birth control method and describe it following the model that you saw in the lesson here. So we've got all these different methods that we talked about from the beginning. We've already done condoms and implants, and so maybe don't do those. Do something new and different. Okay? Bien. Preguntas? Post them below. If you have questions, we'll be happy to answer those questions for you. And if you need a conversation partner, head over to our Learning Medical Spanish Facebook group. Post in there, hey, I'm an intermediate speaker, I'm a beginner, I'm an advanced, and I would like a conversation partner. I'm working on my medical Spanish. Bien. Speaking of medical Spanish, medical Spanish immersion is an amazing way to earn some CME credits, really launch your Spanish forward, and have a great time while you're traveling with other like-minded healthcare professionals. And so take a look at our medical Spanish immersion programs that we offer twice a year, winter and summer, and we would love to have you join us on one of our upcoming trips, either in Ecuador or Costa Rica. Muy bien. Bueno, amigos, gracias por aprender español conmigo. Juntos mejoramos comunidades. Together we truly are improving communities. Para más español, head over to the website, Common Ground International. And if you would like to take a medical Spanish terminology test totally for free, head over to Certified Spanish. It's our medical Spanish certification app, but you can get in there and take as many free medical Spanish tests as you would like and see how you're doing with vocabulary in a variety of different contexts and professions and subcategories. Bueno, amigos, muchas gracias otra vez. Nos vemos la próxima vez. Chao.